Hold on. Imagine living a perfectly normal life. You go to school, you have friends, you play sports, you're just a normal kid. You get good grades. Then imagine if you feel out of place, you don't feel like anybody else. Your reality doesn't match up with what everybody else's seems to be. You feel alone and scared, and you hear voices telling you things to discourage you, telling you that very negative things. This is reality for some people who suffer from schizophrenia, paranoid schizophrenia. Today I'm going to describe to you what schizophrenia is, what the causes are, and how people seek treatment, and what the treatments are. According to WebMD, paranoid schizophrenia is a serious brain disorder that distorts the way people perceive reality. The first thing that people experience are called delusions. Delusions are very strong beliefs that these people seem to believe, and they are false beliefs. They have no way, they're not going to happen. There's something like conspiracies, like they are paranoid that the government is going to be out to get them. They're paranoid that there's going to be some sort of apocalyptic something. So that's a delusion. Another symptom is hallucinations. The hallucinations tend to be auditory most of the time, although there are many people that do experience sensory hallucinations, which is they feel people, they see people, but most of the time it's auditory, they hear voices. To be considered a paranoid schizophrenic, you have to go through what is called a psychotic episode, and you have to be in psychosis. Psychosis is when you completely lose touch with reality. So you're so far wrapped up into your delusion and hallucination that you are completely out of touch with what is real. You are wrapped up in your own mind and what is going on within your illness. Now that you have some background about what schizophrenia is, I'm going to talk to you about the factors that cause schizophrenia. Scientists aren't exactly sure what causes schizophrenia, but they do know that there is a direct relation to schizophrenia with genetics, with some environmental factors. According to the National Institute of Mental Health, the schizophrenia everybody is susceptible to schizophrenia by 1%. So all of us here, there's a 1% chance that we can get schizophrenia. But once you have a direct relative, like a sibling or a parent, your chances skyrocket to 10%. There's a 10% chance that you can acquire the mental illness. And in identical twins, the chances are 40 to 65%. But because the chances between identical twins who have the same genetic makeup are not 100%, scientists can tell that there are environmental factors that do affect you getting schizophrenia. So environmental factors can be stressful or traumatic experiences, usually young in early life. So like anything from abuse, child abuse, molestation, marital abuse can trigger schizophrenia. So genetics make you vulnerable to the disease, and your environment triggers the disease to go on later in life. And treatments. Now that you know how you can acquire schizophrenia, let's go over some treatments that people go to seek. People seek antipsychotic medication. So this is just a pill, or it could be injected, that people get to stop the hallucinations and stop the delusions. These medications usually work very quickly, if they work at all. They usually stop the delusions within a couple days and the hallucinations within a couple weeks. But unfortunately for some people, it's hard to find the right medication. They have to go through a lot of testing and a lot of trying medications. Sometimes it doesn't work. So they have to go to just therapy. And it's called cognitive behavioral therapy. Cognitive behavioral therapy is for people who cannot find medication that works, and they have to go to therapy to learn how to deal with their mental illness and just block out the voices and learn to know what is real and what is not real. Another is psychosocial treatment. This is for some people that the medication did work, but maybe not fully. And it's just to help them deal with things like building relationships, because when you have schizophrenia, you're in your own world, it's hard for you to build relationships with people, to have normal, everyday life, going to work, have a set schedule. That's just to help them to go through the motions. Now that I have told you what schizophrenia is, what causes it, and what the treatments are, I hope that you have a better understanding of this mental illness.
All right, Lauren, everything was very solid. I didn't see anything that is problematic, something that you should be concerned about jumping on right away. There are a few things that you could do a little bit better. For example, the visualization that you have at the beginning, I think it's fine, but it's a little abstract and it could be more compelling. I think instead of a visualization, a particular example might have worked a little bit more effectively. You got a very clear statement of your goal and an excellent preview, so everything is solid there. For the most part, you've got good research in the presentation. You explain things pretty clearly and deliberatively. The visuals are mostly listing of information, and so it's not that hard to follow them, and they help make the transitions and help organize the material while you're talking about it. I don't know that it adds a lot of understanding, but it does kind of keep us where you are in the presentation, so there's some valuable help from that. On the delivery issues, you do have a tendency to stand behind the desk a little too much, and when you do come out from behind it, I think that you want to be a little bit more forceful and purposeful. Gestures, there are some good indicators while you're speaking. Sometimes the gestures that you have, though, are just those crutch things that you go to, you know, kind of clasping your hands sort of thing, because you're not sure what to do with your hands, so you're just looking for something, and so you just go automatically to that position. It wasn't distracting, but it's something that, remember, you're talking to people, and if you're having a conversation, you'd probably be a little bit more engaged, so you could do a little bit better on that. I'll tell you what, you have pretty good eye contact with Cynthia. You know, I'm not sure about the rest of us. I mean, I felt like you looked kind of in this direction occasionally. If I was sitting on that side of the room, I'd have felt largely ignored, because I don't think you looked over there maybe more than a fraction of a second at one time. It really seemed like, I'm just going to look at the people that I'm able to relate to, connect to. This is.
I was looking at her because she had the notebook.
Yeah, there you go. Yeah, so you're watching the time there, you know, yeah. That sort of thing. Okay, so like I said, you were looking up.
And the red hair.
You know, and you know, but you want to look around, and like we talked about, probably the easiest thing to do is to make sure that you talk to everybody a couple of times during the speech. Don't talk to everybody at the same time, but make contact with each individual person at different points in the speech, and that kind of forces you to remember, oh, I need to kind of engage people, and try and avoid this just the scanning thing, like you're going across the room and then back, and then going across the room and then back. You didn't do that, but like I said, it was mostly I'm looking up, and once in a while the eyes would go. You'd give that kind of diverted gaze toward other people, but usually it's just like this row right here got all the focus. And I know I'm sitting here and the time cards are sitting here, so I know that that's kind of what's going on there. It was easy to hear you. I do think that you've got pretty good variety. Sometimes I think the energy level could be a little bit stronger, but again, there wasn't anything wrong with it, just stuff that you could do better, I think. All right, thank you.